Hey, welcome everybody to Fairfield Public Library and our Medicare 101 program. I'm thrilled that I didn't understand I was going to have the father and daughter, so I'm very excited. So here are Lou and Jessica Pelletier to teach you about Medicare. They would like you to unmute as long as there isn't background noise in your house so that it can be more of an interactive experience. Lou and Jessica, take it away, and thanks for coming.
Hello, Claudia. Thank you so much. And hello, Fairfield. We got to wake you up here on our Hump Day Wednesday. Thank you all for attending our Medicare and Beyond class. And it is beyond because, yes, we're going to dive into Medicare, hopefully open some things that maybe you haven't heard about before. But above and beyond that, one of the things I've seen for all the years I've been teaching classes is just a lack of knowledge of all the different laws and programs that impact us folks, and I'm included, over age 60. And I'm just going to give you an example because I've dealt with it. If you ever had a situation where you've taken care of an elder parent, friend, somebody, maybe they're not in the best of health, maybe they're not in the best of financial situations. Do you know the state of Connecticut will pay you $25,000 a year to take care of that person? It's a program called Community First Choice. It's under the Department of Social Services. It's been out for over 2.5 years, and most people in the state don't even know it exists. And that's part of the problem is with a lot of laws, a lot of these programs, you may have heard about them, but there's no 800 number to call to find out what's going on and so forth. So unfortunately or fortunately, since I basically just work with people 60 and older, I've gotten to be pretty knowledgeable with these laws and programs. And yes, I'm not an attorney, but as I will say later, I can play one on television. But it's trying to make people aware of how all these things interact, whether it's the Medicare side, or when I do the Medicare class, or on the financial side, when I do the retirement class, just making people aware of things. The other thing is I try to make everybody, when they come out of my classes, as knowledgeable as possible. So some people are hearing this topic for the first time and it's like a deer in the headlights. And for some of you, you're very knowledgeable. You're just trying to maybe fine tune some of your knowledge and or just getting refreshed and so forth. So I try to make it worthwhile for everybody. And because of that, I will throw a lot of information at you just because, I want you to, sometimes people have to do the class, more than once, but, more the merrier. Also, we do have a guide that we'll kind of point out at some point during the class. It's our roadmap to turning 65. It's really a nice piece about all the things you kind of go through when you're turning 65. From the Medicare standpoint in one convenient little location. So without further ado, hope you have your pens and pencils handy. Again, it is open microphone, so please ask away. Chances are a question you have, maybe somebody else has. As with all classes, at the end of the class, I will stay around to answer any and all questions. So, and for those of you that are shy, we have that little chat box that's there at the bottom.
Which we are checking early and often. So please ask away because like you said, bottom line, you might have a question that your neighbor has. So, and obviously we're not in a classroom, but we want to have it open mic where, because that's where it gets exciting. It's like when you're in a classroom, hearing all the things going and it keeps you awake, one, but two, keeps you going. So yes, we don't want to wait to the end. Yes, we will wait to the end to answer any all questions, but obviously, as we go through, please ask away. It's the best way to do it. So,
without further ado, we're off and running. Your presenters, the one and only father and daughter team, Lou and Jessica Pelletier. The one member of this team has been teaching classes on Medicare retirement planning now over 40 years. I started when I was 5, child prodigy.
He was a baby.
And again, as I mentioned, I teach classes with other libraries in your area. And across the state. I also teach classes for adult education. And then I teach at some of the hospitals for the employees of the hospitals. For you guys, the closest one would be that little hospital called Stanford Hospital, which we do quarterly classes for their employees. So I must be doing something right if they keep having me come back and offer these classes. But again, I try to make them as informative as I can so that you can get something out of it. So our mission, to boldly go where nobody from Fairfield Library has gone before, to learn about the world of Medicare and beyond. This class is educational. So You may have questions about specific companies because it's educational. I'm not allowed to mention specific company names, but I'll kind of get the point across, and I think you'll be able to understand where we're going, whether it's on the supplement side or advantage side. So our mission, our agenda, what is Medicare? Once you're on Medicare, what's the difference between a Medicare supplement plan and a Medicare Advantage plan? Again, once you're on Medicare, you have these Part B premiums. How much is it? What's it based on? This thing called the donut hole regarding prescription drugs. There was some thought that this was going to go away. What's going on with that? Health services that Medicare does not cover. For those of you that have a group health plan, you may have benefits that pure Medicare does not cover. What lies ahead for legislation for 2021 and beyond? There was already a big change that occurred for this year, and we'll see what happens for next year. And finally, as I mentioned earlier, all the different laws and programs that are out there. At the end of the class, we're probably going to spend about 20 minutes just going through three of the laws that I think are good starters for everybody to learn about. And by the way, these laws and programs impact people from all walks of life financially, somewhere for folks in the low end of the financial world to folks that are multi-millionaires and anywhere in between. So to begin, we have that lovely little two cards there at the bottom of the screen. So when we get into what is Medicare, what's the big change that occurred? Last year, Medicare finally figured out that these cards that have your Social Security on their number on there are probably not a good idea, because it's like you go to your doctor, your hospital, and they ask you, all right, what's your Medicare number? It's like, all right, everybody, I'm about to give away my Social Security number. Is everybody listening? So they finally, it took them about 50 years to figure that one out. So they've now come up with a unique number that just pertains to your health insurance for you, not your spouse, not anybody else. Now, everybody who's on Medicare should have that card on the right-hand side. And anybody new to Medicare should get a card that looks like that. But if you know somebody who's been on Medicare who still has their old card on the left, see if they can either find the new card or request a new one. Because if they want to get or change their Medicare supplement plan or advantage plan, if you don't have that new card, you won't be able to get it.
Because over this past actually open enrollment period, we came across more than a few people that never got their new Medicare card. So please check to see if you have this new card with a special number, letters, because it's like you said, it's the only way you can sign up for a health insurance plan with Medicare.
So who's eligible for Medicare? So we're going to start off with the first pop quiz of the evening. When you turn 65, do you have to sign up for Medicare? When you turn 65, do you have to sign up for Medicare? And in my classes, there are no wrong answers.
So what does everyone think? Yes, no, maybe?
Slightly amended.
Yeah.
Okay, any others?
My employer told me I had to at 65, and then it disqualified me for contributing money to my HSA.
Good
So
point.
I was not happy about that because they didn't know that.
We do. Okay, so the big thing here, if you are still working, or if you're married and your spouse is still working, you do not have to sign up for Medicare. Now, some people will say, well, I can sign up because I want to get the Part A and get my card, but you do not have to sign up. The only caveat to that is if the company that you work for or your spouse works for has less than 20 employees, Medicare does not consider it a viable plan. Then you work till 68, think you've got good coverage because you've been working, then you apply for Medicare and you get penalized. So unfortunately, the burden of proof is on you, the consumer, not the employer, as far as is their plan, viable or not. And even if you do work for a company and when you're 65, they still may require you to sign up for Medicare, depending on what plan they have, what type of plan they have. And we're going to get into the HSA side of it. Yes, if you are contributing to an HSA, by law, they want you to stop contributing to the HSA, health savings account, 6 months prior to going on Medicare. Now, how can they actually verify that? Good luck. But anyways, it's part of the law. so that they kind of like you. I think at best, maybe stop, contributing when you do sign up for Medicare.
That's what I did, yeah.
Now, there was a question regarding, can you delay to sign up if you were self-employed? The answer is no. Because if you're self-employed, you're not on a group plan. You're on either the Access Health Connecticut plan or individual plan with one of the companies. That's not a Medicare viable plan. So, and unfortunately, I've seen a number of people who thought they were good to go.
And then, which we'll get into, you can end up with a permanent penalty if you stay on that and do not go onto Medicare.
The other is if you're in the military, and you have VA coverage, or you're in the military 20 years or longer, they have what's called TRICARE for life. With those systems, you still have to sign up for Medicare, but then you go off into their medical, insurance coverage and so forth. Now, one thing I've dealt with over the years, many people are not aware of, even if you have VA or TRICARE for life coverage, you can still sign up for a Medicare specifically Advantage plan, because there's benefits that your TRICARE VA don't have. And in fact, the way it works is your Medicare Advantage plan would go in first position, and the TRICARE for life would pick up any deductibles, copays, or whatever that the Advantage plan didn't pick up. So again, anybody you know of that's in the military, it's something to keep track of. Besides that, though, everybody else turning 65, yep, you have to sign up for Medicare. What is it? It's government supplied health insurance. How do you sign up? The easiest way is to go to a website called medicare.gov, medicare.gov. In the upper left-hand part of that screen, there's a drop-down box that says sign up for Medicare online. The one thing they're going to do, which then lead to the next question, is they're going to have you fill out this My Social Security account and create this site. And during that process, they're going to ask you 5 questions about your credit history, because they want to verify that you are you. So they may say, in 2017, did you open up a card with Macy's, JCPenney, blah, 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 blah. And one of the answers might be none of the above. So again, you want to make sure is that you know those answers. And if you don't get it right the first time, you can do it again, so that you don't worry if you get stuck the first time. Now, there was somebody just asking a question about.
It's most likely your computer. Maybe you zoomed in or clicked on it.
The question is, the material displayed is bigger than the window, so I cannot see all of your PowerPoint slide. Is that my computer, or is anybody else experiencing this?
No, I can see everything very good.
Okay,
Thank you.
so
Yeah,
I think
probably
somebody's,
just zoomed in, or
so-
like what's these sensitive screens, you can just touch it. So, but we've never had a problem in the past. So
If you're using a laptop with the little square finger thing, if you just go like that or go like that, squeeze your fingers, shrinks it down.
there's always going to be some nice computer folks in our classes.
thank you.
Or
Good
computer
advice.
knowledgeable folks. Yes, thank you.
She said it's okay now, so we're good.
Did it work?
Yeah.
Thank you. You just helped save the day. Yeah.
All right.
Happy to
so
help.
now here's the other thing, though. So yes, you can either sign up going to the Medicare.gov, or you can, in the old days, you could just go to the Social Security office, the closest one to you, and sign up there. Or in this case, because of COVID, you can make like a Zoom appointment or phone appointment to do it. But here's something else. What if you're collecting Social Security at age 62, 3, or 4? Whether you want to go on Medicare or not, the government thinks you do want to go on Medicare. So they're going to sign you up. They're going to send you the card with the Medicare Part A and Part B start dates. But what if you're collecting Social Security and you don't want to go on Medicare? You have to say time out. You have to opt out. Because if you don't, they're going to assume that you do want to go on Medicare, on Medicare, and they're going to start charging you. So just be aware that if you or anybody you know is collecting Social Security before 65, they're going to sign you up automatically. Now, for somebody that wants to go on Medicare at 65, then don't worry about it. But if you don't want it, the burden is on you. So any questions about what is Medicare? So here's the big thing, that before we get into the meat and potatoes of Medicare, I like to go through all what we call the enrollment periods, because one of the things we've seen with Medicare is that whether you're 65 or 70 going on Medicare for the first time, they pick a plan, whether it's a supplement plan, an advantage plan. They may have done homework for it or not, but then they just go on automatic pilot and they forget about it. And every year, if you do nothing, the plan you have this year is the plan you're going to have next year, with some exceptions. So over the years, we've seen many people who weren't reviewing their coverage, and all of a sudden, whatever plan they were on was probably not the right plan they needed to be on at the current time. So we go through these enrollment periods, keep them in mind, because for many people, your health insurance was dictated by your employer or your spouse, and all of a sudden you're on Medicare, whether you're married or not. The burden is on you, because the plan that your spouse might have if you're married may or may not be the plan that you want to have. So again, early and often. So the initial period is called the initial enrollment period, which is for people turning 65 going on Medicare. With this, there's a 7-month window. It's the 3 months before you turn 65. It's the month you turn 65, and the 3 months after you turn 65. As long as you sign up during those 7 months, there's no penalty. Or so they tell you there's no penalty, but there's kind of one built in. Because what happens is, let's say you were born April 15th, 1956, turning 65 tomorrow. Texting. So you're eligible to sign up the 3 months before, January, February, March, and you'd be effective April 1st. But if you signed up today, your Part B wouldn't be effective until what's month after April? May. Which means your Part B wouldn't be effective. And without the Part B, you can't get a supplement plan or advantage plan. And it gets worse. So let's say you waited till May, still within the legal period, but you couldn't get your Part B until July, 2 months later. If you waited until June, you'd have to wait till September. It's 1 month late, 2 months late, 3 months late. It's just a quirk in the system. So I tell everybody, if you think you're going to be going on Medicare when you turn 65, sign up during those 3 months. In fact, you can get a supplement plan or advantage plan if you were turning 65 in April by midnight, March 31st. You hopefully did the A and B a little bit earlier, but you have time to do it. Don't delay, because it can be just, again, an unnecessary aggravation that you're going to have to go through.
Because one example which we've come across, say you do plan on working, like one lady we had was working at the bank. She all of a sudden finds out she's 65 and 2 months old, and they letting her go. She ended up falling into this loophole. So unless you are planning on going on Medicare, or you're planning on working, this is not some, make sure you sign up before that time period, that you don't fall into this gap, because we've seen it ends up being a major headache for those out there. And by the way, these enrollment periods are from the most important in order. So, but yes, don't wait, because you know what? We've seen it. It just ends up being a major headache.
Here's one more for you. Does anybody in our audience have a birthday that's the first of the month?
Anybody? This is a great question. So we don't actually see many first of the month birthdays.
So if you were born April 1st, 1956, turning 65, you're actually eligible for Medicare the month earlier, March 1st. So if you come across anybody, they're actually eligible to start that coverage the month earlier. But everybody else, and Medicare is always the first of the month.
And by the way, with initial enrollment period, it's the first plan you pick. It's a one-time choice. So make sure when you are turning 65 and going on Medicare, pick the right plan the first time, because then you're stuck until the next period, which we're about to get into, is open enrollment period.
Which currently the window is October 15th through December 7th. And again, this is crucial. Spend at least a few moments every year, once you're on Medicare, until you're no longer on this planet, making sure the coverage you have is the right coverage for you. And this window can change at times a little bit. It's been a little bit earlier, a little bit later, but lately it's been this October 15th through December 7th. And the nice thing is with this window, you can change your mind more than once. So let's say you were hanging out with some of your friends, you heard about this great new plan, and first day of open enrollment, you signed up and you were good to go. And then November 1st, you find out, well, one of your doctors isn't there, or you got a new prescription drug or whatever. Don't worry. It's the last plan you sign up for during this window is the one that they're going to make effective going to the next year.
So you can enroll multiple times, but it's the last one. And one thing else I'm going to suggest, say you think the plan is the same, please review, because for example, the Medicare Advantage side, which happened this past year, actually, the plan was relatively same, but they changed the drug formulary. So within that, some of these people we were helping end up, their drug costs went through the roof and had to change out of that company. So when in doubt, please review early and often.
And I'm going to give you, here's, unfortunately, life keeps changing. Has anybody ever seen the commercials with Joe Namath, former New York Jets quarterback?
It's going around a lot lately.
Yeah. Does anybody think he actually works for the government?
Mm-hmm.
Well, a number of people do. And in fact, the number of people that have signed up through that organization, well, they're not from Connecticut. They may have a basic knowledge of the plans here, but we've been coming across more people who think it's Medicare or something else. They sign up for a plan, and it more than likely is a worse plan that they either were already on or that was available, because these companies don't know the ins and outs of the different companies within each state.
Especially within the state of Connecticut, because you can be talking to somebody, say in Texas, but they're just looking at a computer screen and asking maybe you some questions, but they're not going to know within the state of Connecticut what each plan and makes them unique and special based on your situation. And that's one thing we actually do.
Finally, every state has different laws when it comes to Medicare. So, and a lot of people aren't aware of that. So anyways, open enrollment, you've got multiple times to make a different selection if you need to. The next window is the special election period, which hits two groups of people, either people who are over 65 years and 3 months that worked beyond that, then finally went on Medicare, or people that for whatever strange reason decided to move from the state of Connecticut to a different location because they love our taxes. Again, you have a 2-month window to sign up. So let's say you were planning to move to Florida on June 1st. You could sign up during the month of June and July, but you can also sign up in the 2 months prior, so it's effective June 1st. So that new state you're going to or whatever, you've got that plan in effect immediately. And it's because of the drug plan portion of it is why, because you may see some things about an 8-month window for special election, but that doesn't apply to the drug plan, and that typically is what messes people up. So it's really a 2-month window. And finally, we have what I call the get out of jail free card. For those of you that
fell asleep during an open enrollment time.
So we have what's called the Medicare Advantage open enrollment period, which is the first 3 months of the year, January 1st through March 31st. This is only for people that are currently on a Medicare Advantage plan. And if they are, they can either switch to a new Medicare Advantage plan, or they can go from a Medicare Advantage plan to a Medicare Supplement plan. The only thing that can happen during this window is if somebody's on a Medicare Supplement plan and they want to go on a Medicare Advantage plan. They can't do that. And again, this is the get out of jail free card. You got one shot. So again, doctors change, drugs change, find out about this plan's got a great dental coverage, whatever it might be.
Or maybe you're going to have a major surgery. You don't want to have to worry about going to doctors, physical therapy, co-pays and whatnot. Maybe you'll switch. So yes, this is a great way to know that you are never stuck when it comes to Medicare.
So can I ask a question? If you're on the supplement, if you're on the supplement and you want to switch to the Advantage, you have to do it between October and December.
That's correct.
Correct, during open enrollment period.
Okay.
There we go. So we're about to get into the meat and potatoes of Medicare and so forth. But as I mentioned earlier, Jessica and I, we put together this nice little checklist.
Yeah.
basically a roadmap for turning 65. It also gives you access to our website and so forth. And
Which is we're building. It's actually almost 100% complete, our website. We are still adding some more information on there, but one more thing is we have to get our pictures taken, and we're going to be putting some videos of educational stuff together, because the one thing we're finding is the lack of education and clarity out there where to go. So that's one thing we've been working on through the whole COVID, everything shut down time. So yes, this is one thing that I promise this will be a great guide, especially with everything being so confusing when it does come to Medicare. What are the right times to sign up? So this is one thing that will help you, that you don't have to write everything down.
we've actually turned one of our conference rooms into like Steven Spielberg studios. The umbrellas and lights and teleprompters.
Getting a little technical here.
When you move from scan.
So anyways, we're going to move on. If anybody doesn't get it, will be available.
And we can always email you the link.
All right, so what is Medicare?
I just missed it.
Oh, I can go back.
Oh, thank you.
Oh, you're welcome.
All
Okay,
good?
thank you.
So what does Medicare cover? Medicare has two components: Medicare Part A, your hospital coverage, your inpatient hospital coverage, and Medicare Part B, all your doctor expenses and any outpatient type procedure, whether it's outpatient hip replacement, like a certain wife of mine just had last Thursday, or an MRI, CAT scan, or what have you, all go under Part B. Both of these are designed to cover a large portion of those expenses, but not all of them. So Part A, your hospital inpatient coverage, pretty much covers everything involved with being inpatient to a hospital, but it has a deductible. And what's different is this deductible, it's called a per benefit period deductible. I really call it a per recurrence. So roughly the first $1,400 or so of that hospital stay, you're going to be responsible for. So let's say you're inpatient, you're having that left hip replaced, stay there in the hospital for 4 or 5 days. You like it so much, you go back 6 months later for the right hip, there'd be another over $1,400 deductible that you'd be responsible for. And then after that, your first 60 days in the hospital, there's no expense for you. Everything is covered. If you're there over 60 days, well, then you've got a little bit of a problem. You're looking at $350 a day or more. But it's very rare these days for somebody to be in a hospital more than 2 or 3 days, never mind 60 or 70 days. Now, the nice thing with Part A, for a majority of people, it costs you nothing.
As long as you work 10 years or 40 quarters, you should be good to go. Or your spouse works 10 years or 40 quarters.
If that's the case, you pay nothing. But what if you're a little bit shy? Maybe you were a teacher, you didn't work as many quarters for whatever reason. If you're between 30 and 39 quarters, you're roughly at a little over $200 a month. And if you were less than 30 quarters, then you're over $400 a month a premium per person for the Part A. Now, the one saving grace is for anybody who's on Medicare, didn't quite have enough quarters, you can backfill them in. You can get a job over at Costco or Home Depot or whatever it might be, making roughly $1,700 a quarter. That counts as 1 quarter. So you make your $65,000, $7,000 in a year. You've just backfilled in 4 quarters. So even if somebody doesn't have enough quarters, there are ways you can backfill it in. And if not, then you got to look for alternatives as far as how to get that covered.
You just lost me. You mean when you're 65 and you retire and you go on Medicare, you have to still go to work to pay for Medicare? I don't understand what you're saying.
These are the people that didn't work 10 years or make the 40 quarters. So we're just going, this is the meat and potatoes, like the basics of what Medicare, the original card, stands for. Then we're going to go into your what your supplements and advantage to cover the 80 to 20% that you're on the hook for.
Yeah, so it's less than 1% of the population has to pay a premium for Part A. 99%, either because they're married, they got it through a spouse, or themselves working the 10 years or so.
So most people never have to worry about this. We're just telling you what Part A actually stands for and a little bit about it.
So here's a little sidebar, which is to me is really crucial, because we just see it happening more and more. Now, has anybody here ever either themselves or know of somebody who's gone to the old emergency room because you weren't feeling so well, and the hospital says, you know what, you're not looking so good, so we want to keep you overnight.
But what are they telling you? What is the term that they're doing? Not
They're
admitting
admitting you. They're admitting you.
Instead of admitting you, what's the term they're doing?
It's becoming a big, and they'll use it usually in a sentence of some sort. Any idea?
Observation.
Bingo.
Yes.
Sometimes they'll use the phrase admission under observation, which means technically you're not at the hospital. So what I tell everybody who hears the word observation, what do you want to do? Scream! Because if you're under observation, you're not covered under your Part A.
Oh, wow.
You're covered under the Part B,
Which is outpatient care.
That's that Medicare pays 80, you're on the hook for 20. Now, guess what? Maybe the reason you're at the emergency room is that you don't feel so well, so you really can't scream for yourself. So everybody in our audience, anybody you know of, they should have a legal document called a medical power of attorney. This allows somebody to speak or yell in your behalf. Because what happens is you go into that emergency room, you get placed under observation. What's the first thing that happens? It's not your primary care doctor, whoever that's going to be in charge of you. It's the lovely person called a hospitalist. And I was just doing the math the other day. A typical hospitalist works a 7-day shift, a 12-hour, 7-day shift. The average having 100 patients. So do the math, divide 100 patients in a 12-hour shift. That means they have about 7 minutes a patient. They think they're going to get to know you in detail and all your medical history and everything else. No. So by having that medical power of attorney, it allows somebody to reach out for the cavalry, like maybe your primary care doctor who actually really knows you.
Or your cardiologist if you were in there for heart condition.
Because what happens is the reason hospitals are doing it, if you get admitted to the hospital, let's say you have congestive heart failure, you get admitted, then you get discharged, you're doing better. Then you come back 90 days later with the same issue. Two things are going to happen. Number one, the hospital is going to be fined by Medicare for letting you go too soon the first time. More importantly, that next visit to the hospital is on their dime. So let's say you have that congestive heart failure, and that second visit, you need open heart surgery. They got to eat the entire cost of that. But if you were under observation, you were never there. So hospitals aren't doing it for your behalf, they're doing it for their behalf. Now, when I say scream and bring in the cavalry, is it going to change the outcome from being under observation to being admitted? Probably not, but it's going to make them more aware that you're there, you mean business, and they better not be messing around, and bring in the right people. And I went through it with my mom once. I've got medical power of attorney, and she went on a Monday. By the time I got word of it, she was already discharged. Next day, she goes by ambulance back to the hospital. I won't mention which one. This time I get word of it. I get there and I kind of let them know I'm a little bit of a Medicare expert.
Which he did because I was there with him.
Long story short, my mom had pneumonia.
Which they never caught.
Which she had the day before. So again, having somebody there to be an advocate, because literally that day she was in the ER, that second day, I had to walk around the entire ER to get to the room she was in. And every room had patients in them. But every room I went by that had an elder patient,
they were by themselves.
They were on a gurney all by themselves. Nobody there to be an advocate. Now, granted, some of them may have come from a nursing home or whatever, but it was just sad.
Because the bottom line, you want to make sure that you are getting the best treatment possible. And, these like doctors, emergency rooms, and like you said, hospitalists, they don't know you. So having that person come in and step up for you when you're in their worst case scenario and say, you know what, I want so-and-so to get on the phone right now. Come in, please. This is your specialty, blah, blah, blah. Because you know what, you're going to get the better care that you deserve at that point. And you don't want to wait until it's too late and then all of a sudden have that pneumonia that could have been caught.
And there are other legal documents. This is the medical power of attorney. You all should have what's called a durable power of attorney. It's a financial one. living will, which says pull the plug, don't pull the plug. It's your decision.
And just one more thing, if you, whoever the advocate is and has that medical power of attorney, they can save it on their smartphone, show it as a PDF, and they can email it. And this is a great tool. I highly recommend everyone has it. If you don't, please go get one.
Good idea.
Little sidebar. To me, it's very important information. All right, Part B, your physician and outpatient.
Can I ask a question?
Oh, sure.
Okay. So you're saying that if someone were admitted and they were admitted as under observation, can you say in the emergency room, I don't want this person admitted as under observation, I want them admitted? Can you say that?
You can encourage it, but what happens is whoever the ER doc is, they make the initial decision. And of course, most of them are making it under observation. But then it goes to what I call the ivory tower. There's a case manager who's going to give the ultimate final say. Yes, you can, again, being that advocate for that person. They've got, there's been chronic history of chest pains, and we're worried about this getting much more severe and whatever. You don't have to get into the insurance side of it or so forth, but just say you're concerned. You want them, treated, properly. Because some outpatient stays, you're actually kept in the ER. You're not brought up to a regular floor.
Right, yeah.
Especially the bigger hospitals have expanded ERs that have outpatient areas. So anyways, just you want to have an advocate, or you can have more than one there, pulling for you. All right, Part B, the physician outpatient coverage. Again, designed to cover a large portion, but not all of it. This has two components. It's got a one-time deductible, which is the first roughly $200 of any doctor visit or any outpatient procedure or service. After that, in those big red letters, Medicare pays 80% of the bill. You're on the hook for 20%. Very straightforward, cut and dry. Now, the thing with Part B is it has a premium. And this is what a lot of times scares people, because for 95% of the population, there are 6 different levels of premium, but 95% of them are at level 1. So what is level 1? If you're single, making $88,000 a year or less, or married, making $176,000 a year or less, your monthly premium per person for Part B is $148.50. Pretty straightforward. But what if your income was higher? As a single person, $88,000 and $1 up to $111,000, or as a married couple, $176,000 and $1 up to $222,000. It goes from $148.50 a month to $207.90 a month per person. And here's the thing, they're not even, what they look at is your adjusted gross income, but specifically what they're looking at, what's called your modified adjusted gross income. For example, the big thing for most people when it comes to modified, if you have any tax-free bond income coming in, which is tax-free, you're not paying taxes on it, but that income is included for this calculation. So premiums can go up to over $500 a month per person.
There's actually 6 different tier levels, and as long as you go down or up a tier, they're going to catch it.
So here's the catch.
They don't catch it going one way.
Whether 2021 is your first year on Medicare or your 30th year, they're always looking at your income from 2 years earlier. So in 2021, they're looking at your household income, whether you're married or single, from 2019. But what happens if in 2019 you were higher than level 1? You were level 2, 3, 4, 5, or 6.
You're working, having a great year.
They're going to catch you and they're going to charge you accordingly. But if your income drops, they know nothing, and it gets worse. What if you've been retired, you've been on Medicare, then 5 years down the road you have a windfall, you sell some property, something happens, they'll catch you. They will always catch your income when it's high or goes high to a new category. But for some strange unknown reason, when it goes down,
they never catch it.
In fact, if you go to your lovely Fairfield library, you might even have a certain book, the Handbook of Social Security, and it's right in the book that says the burden of proof is on you if your income goes from a higher category to a lower one. So there's actually a form you have to fill out. Get ready for this one. It's like the old hurricane. It's called IRMAA, IRMAA, which stands for Income Related Monthly Adjustment Amount. You have to say, you know, my income went down, I lost work, reduced work. It's got to be some specific thing. And then you've got to send that into Social Security. And you don't have to wait. So if they're looking at 2019, 2021 is your first year, and your income dropped after 2019, you send it in right away. As soon as you apply for Medicare, get that card in.
That's actually brand new. A few years ago, this only just changed recently that if your income is up, but you just went on Medicare and it's dropped from when they're looking, go and please send it in, because you know what? It's money in your pocket, not theirs.
Yeah. Is there a time limit? Because as you're explaining this, I realize they're charging me the higher amount, but my income is not the same.
Well, here's
that's one of the reasons why we're bringing up, because so many people are never actually catch it or realize it.
So let me give you two real life examples that I've dealt with, and then we'll kind of put it in a little neat bow. So example number one, I had a couple in their late 70s that had sold a nice little piece of property for about $500,000. So at the time, it bumped them up to the highest level. They had been at level 1. So when I met them, they were in year 3 of still paying their higher premium when their income had dropped the year after the property was sold. Well, both their lovely CPA, who's been doing the returns for years, and their financial advisor, or as I like to call him, their former financial advisor, neither of them caught what happened. So Mr. Liu comes along. Not only do I stop them from paying the extra premium they were paying, and it was significant *2, I was able to get them reimbursed for the year and a half they paid extra.
Oh, really?
Now, not long ago, in a town
before COVID, in a town not far from you, at a woman that was in her late 70s. When she was 65, her husband was a physician, passed away. And at the time, they were at level 4. Well, for 14 years, she paid level 4 premiums. When after the husband died, she went to level 1. Her big accounting firm and even her bigger financial firm, none of them had caught this. So of course, she wasn't happy with the messenger for making her aware of it. She just felt she was taken advantage of by the system. Why didn't anybody ever make her aware of it? So I was able to have her stop paying the increase, but I was not able to get the 14 years of reimbursement. Because it's been too long.
It's been too long. The burden is on you. And it's a sad state of affairs that, unfortunately, when it comes to our age group, there's either people that just want to deal with Medicare and sell whatever the hot Medicare plan is and go on their way without paying attention. Or on the financial side, they want to manage your money and tell you how wonderful they are, but they don't want to deal with all the other aspects of it, including this and income planning and so forth. So again, having somebody that's going to be in your corner, because the state of Connecticut, we know, has the highest percentage of people paying more than they should for Part B than any other state in the country. And many of it is literally down in Fairfield County. People just aren't catching it. Because what happens is you go on Medicare.
There's 2 ways you can pay for Medicare.
If you're collecting Social Security, you can have that payment come out of your Social Security. And if you're not on Social Security, you set up a quarterly payment. But let's say you're on Social Security. You get the statement once a year saying what your Social Security benefit was. Then in there will be how much was deducted for the Part B.
Yeah.
How many people really scrutinize to see that, what was taken out?
Divide it by 12 and see what your actual Part B amount is. And most people, I don't think, do it.
So big picture here is it's never too late if you're not sure. Because again, even if your income goes up down the road, they're going to catch it. But it's the going down, the burden is on you, the consumer. It's just
the lowest you can pay is $148.50.
That's correct.
If your income goes down for any reason, can you file that form, that IRMAA form, or does there have to be a specific reason?
There has to. number one, it has to go from a higher category to a lower category.
Right.
If you're in level one, you're at 80,000, your income went to 70, you're still at level one, it's not going to make a difference. But if it's going to change the premium because you're going from a higher category to a lower one, then by all means. What I tell everybody, there are categories that you have to check off when you're filling out that form. It has to be done correctly. So again, having somebody who's a little bit experienced and helping filling out that form so it gets approved, because not everybody gets approved. Even though you have, wait a minute, my income went down, why aren't you approving me? Remember, it's the government.
Yeah, but the example that you gave, you say that people sold a piece of land and their income went up. You wouldn't see that in your Medicare premiums until 2 years later. What if 2 years later, you haven't sold a piece of land, so your income does drop a category? Can you then say, oh no, my income's dropped, don't charge me the additional premium? Or do you have to bear it for 1 year and then tell them?
Because of the state of California, I tell people appealing is a great, you can appeal early and often. It used to be you had to wait the 2-year period, but once you know your income is changing, fill out the form and get the ball going. Ideally, if the world ever opens up again, you can go in and do it in person, or at least fill out the form and send it in and keep track of it. Because again,
so just to clarify, if you have that 1 year jump in income, it's possible that you can appeal it and just never pay the additional premium.
You're going to pay for whatever that 1 year is. If it's, in other words, if going forward you don't have any more increases, you can get away with, because you turn 65, your income is below the level 1 threshold. Even if 2 years earlier it was higher, you can appeal it immediately and try to get them to say, I'm not making that anymore, go forward. It's more for people who have an increase down the road. They're 70, whatever years of age, and they have an increase. But yes.
Right. So in your example, that couple that had the increased premium because they sold a piece of property, they can't say, well, that was 2 years ago. My income is not the same, so don't charge me that. They have to bear up for a year.
Correct. Yes.
Okay.
Only if it happened prior to them going on Medicare.
Okay, got it. So once you're on Medicare, you're gonna have to take the hit for at least 1 year.
Correct.
Okay, got it.
At least start the process and start appealing and just letting them know your income did drop, is what we're saying.
All right, so we're gonna get moving here. We'll hang on.
We won't be around after, but we don't want to make this a midnight class. I think we're just trying to say.
All right, so big thing with Medicare is that they'll pay 80% of most things, which means you're on the hook for 20%. Well, if it's $1,000, bill, office visit, hopefully it's not the end of the world. But if you got a $100,000 same day, procedure, which can happen, believe it or not, that's a headache. So what are your options? You can either go out and get a Medicare supplement plan, which back in the day, we used to call them Medigaps, because they were designed to cover the gap of what Medicare didn't cover. Or you can get the newer Part C Medicare Advantage plans. They're both designed to limit your healthcare expenses. They just do it in different ways. And like everything else in life, there's pros and cons. So Medicare supplements. The basic idea of a Medicare supplement is to pick up where Medicare A and B leave off, where you can either get all of the expenses that the deductibles and copays that A and B don't cover, or some portion of them. Now, depending on your age, there are either 9 plans available or 11 plans available. If you turned 65 last year or earlier, then you're available to all 11 plans. If you turn 65 this year or going forward, you only have 9 plans available. And the reason being is the top plan available, the F plan, the government doesn't want to offer it anymore because it covers the Part B deductible, that roughly $200. And the government wants people paying for that going forward. So if you were 65 last year or sooner, even if you don't have it, aren't currently on the F, you could still get it, your grandfather, but just going forward. So the big thing with supplement plans, the biggest piece of this is freedom. With a Medicare supplement plan, there's no networks, there's no anything. You can go to any doctor, any hospital, not just here in Connecticut, anywhere in the country. As long as they accept Medicare, you can go there. As long as they accept Medicare, you can go there. So, for somebody who's not worried about, cost of premiums or whatever, this gives you the most flexibility, but you're going to pay for it. So let's go through some of what I call probably the three most sold plans in the state of Connecticut, starting with that Plan F for those of you that are 65 last year or sooner. So Plan F was the Cadillac because it covers everything. Any deductible, the Part A deductible, the Part B coinsurance, hospice care, anything you could think of, the Plan F covers. So outside of paying your monthly premium, no matter how often you go to a doctor, no matter how often you go to a hospital, everything will be covered. But it's going to be covered for a price, which gets to the second piece. Whether you're eligible for 9 plans or 11 plans, there's approximately 15 different insurance companies offering these plans. Now, all the plans are regulated by the government, Plan A, Plan C, Plan F, all the way across the board. So all the plans, no matter which company offers it, it's the same plan. The only thing that's different is what do they charge? And that's what gets people. So for example, the Plan F, the Cadillac of supplement plans, the lowest costing version of that is about $270 a month. But there are companies charging well over $500 a month for the same exact plan with no extra benefit. So key rule is if somebody wants a supplement plan, whichever letter, get the lowest costing one, because you're paying for stuff you don't need to. So the F is $270 a month is the lowest way. You do that and away you go. But what if you like the idea of a supplement, but you're trying to save a couple dollars? So the current Cadillac plan available is Plan G as in George, my middle name. So the G plan is roughly $210 a month per person. The only thing it doesn't cover is that Part B deductible of about $200. So if the premium difference between the F of $270 to the G of $210 is $60 a month, that means you're going to save in a year $720, 12 times 60. The most you'll spend is the $200 for that Part B deductible. Your net savings is about $500. Now, there's been years when the spread between the F and the G, where the F was actually financially the better way to go. And it can change as we go through. Now we have somebody joining us better late than never. So the key is you've got to weigh out every year who's the best deal financially. So the G plan, the lowest costing is $210, and there's plans that are hundreds of dollars more a month. Next plan is Plan N as in Nancy. Similar, but a little bit different. Again, N does not cover the Part B deductible, the $200. Secondly, whenever you go to a doctor, whether it's a primary care doctor or a specialist, you have a $20 copay with the N plan. Kind of acts like an HMO or what have you. So that brings up another pop quiz. Does anybody have an idea what they think is the average number of visits that a 65-year-old makes to a doctor in a year? Primary care specialists, the whole gamut.
Any doctor. So
Any doctor. What do you think is the average for a 65-year-old?
And there's no wrong answers here.
6 visits.
Mhm.
6.
Visits?
6, okay.
Okay.
We're off and running.
I'm going to say 4.
4, okay. Anybody else? Gotta get a
I just had an experience with that. I originally thought 6 visits, but I just hurt my ankle and I realized I was going to the OT, physical therapy rather, for it. But the orthopedic kept saying, come back in 6 weeks, come back in 6 weeks. I'm on my 3rd visit now just to check my ankle.
So when I'm down in
Your neck of the woods.
your neck of the woods, Westport and Greenwich, here are my 40 visits, 50 visits.
And as you're saying, it's very easily to happen, especially when you start going to your physical therapy and doctor's appointments. They want to keep having you come back. You know, you hurt that something. Well, now they want you back in 2 weeks to see if it's getting better.
Those allergy shots, whatever it might be.
And by the way, these supplement plans we are going through are the 3 most popular plans in the state of Connecticut. So just to let everyone know that by far.
But you guys are pretty smart, you Fairfield folks. The actual average is 2.7, roughly 3 times a year. Because yes, some people don't go at all. Maybe they go just for that annual physical. And unfortunately, some people have to go 10, 20, 30, whatever times a year.
Because when that thing comes up, you know what, it happens.
So to keep the math simple, let's say you go 5 times a year. So what's 5 times 20?
100.
100. You're adding in the 200 for your Part B deductible. That's now $300 that you're paying out of pocket for N that you wouldn't pay if you had F. However, guess what? The lowest costing N plan in the state of Connecticut is about $170 a month. That's $100 a month less than the F.
It's 190. I have it.
But we're not getting into companies, but what is your plan? No, I mean companies.
We don't want to know.
Which we don't want to know because that means you don't have the cheapest company out there available.
Oh, I get it. Okay. Uh-huh.
We're not saying which company, but just throwing that out.
So if you can get the N for as low as 170 or more, that's $100 a month savings, $1,200 a year.
Mhm.
So you're saving $1,200. You're spending $300 for your 5 visits and $200 deductible. Your net saving is $900 by going from the F to the N. And again, premiums change and tweak and so forth, but
you can never anticipate if you're going to have an incident, you know,
Well,
that's going to cause you to go to multiple visits like Paula has.
absolutely. And some people don't want to be bothered. That's why they do the F or the
Correct.
G, because they don't want to deal with co-pays or anything else. They
And
just-
ultimately, peace of mind, just knowing that they're going to be 100% covered. You know, like you said, you don't have to worry if that you do break your leg and have to go times that you're not going to have to pay anything else.
Now, there's one other thing N, as a Nancy, does not cover. And it's something called Part B excess charges.
Does anybody have any idea what that means?
Part B excess charges.
Nope.
Okay.
So let's say you went to med school, accumulated, a few $100,000 worth of debt. You get a nice job, get a nice shingle, you're hanging up, you're practicing medicine. And the government says, you know what? We're only going to let you charge 40% of your billable rate. So if you're going in for a $1,000 procedure, you're only going to be able to collect $400. Or a $10,000 procedure is now a $4,000 procedure. So guess what? Imagine if you went to work and they say, you know what, we love you, but we're going to start paying you only 40% of what we were paying you. You might not be a happy camper. So the government says, all right, you docs, we'll let you increase the bill by 15%. So if you're charging $1,000, we'll let you add in another $150 on top of that $10,000. So even though it goes back down to $4,000, they can add in. So for some people, they're going to be on the hook for that difference. But guess what? Don't worry about it. There are 8 states in the country that do not allow Part B excess charges. And 3 of the 8 states are Connecticut, New York, and Massachusetts. As long as you're getting medical care in one of these 3 states, then life is good.
Because in most cases, where are you going to go for medical care, either north or south, and to the big cities.
But don't go to Mayo Clinic or Cleveland Clinic because they're going to get you there.
Okay.
With the N plan.
So we're okay. We're okay as long as we get medical care in those 3 states.
Yes.
Yes. And there are a few others, but those are the ones that usually most people go to if we're around here.
So big thing when it comes to supplements, again, is flexibility, is freedom. However, they don't cover your drugs. So as of about 10 years ago, Medicare decides whether you're taking prescription drugs or not, you all have to have a standalone drug plan called Part D as in David. We mentioned earlier that there's 15 companies offering the supplement plans. There's about 45 drug plans available in the state of Connecticut. The premiums can range from $10 or $12 a month to $100 a month. And that premium is based on two things. What drugs are you taking?
And where you live in the state of Connecticut can
What's-
affect.
What's your zip code? So living in the high rent districts, you might be paying a little bit more than some of your neighbors and so forth. So here's the key though. Every plan has what's called a formulary. What drugs do they cover? Now each plan has to cover all the drug categories, but they don't have to cover all the drugs. So you might be on a name brand drug. You're taking Xeljanz because you've got rheumatoid arthritis. See those commercials. By the way, if you see a drug advertised on TV,
They're not cheap.
you know they're not cheap. So let's say you're taking Xeljanz. Of those 45 companies, there might only be one or two that offer it. So again, just like on the other side, you want to make sure you do your shopping. It's the same here. Now, all these plans have what they call preferred pharmacies. With one, it might be CVS, another one it might be Walgreens, another one it might be Costco, who knows? So again, you really want to make sure you're doing your homework. Finally, penalties. Both Part B and Part D have penalties if you don't sign up on time.
For Part B,
For every year that you're late,
mhm,
it's a 10% penalty on whatever your premium is. So if you're at level 1 and you're at $148.50, for every year that you're late, they're going to add in about $15 a month. So if you were 3 years late, they're going to add in about $45 a month for the rest of your life.
but for Part D, if you're sign up or decide for some reason I'm not on any drugs, why should I sign up for a standalone drug plan? Well, here you go. It's 1% a month, 12% a year, permanent penalty for those of you or anybody that doesn't sign up for a standalone drug plan or get a drug plan with the Medicare Advantage.
No, and the thing is,
I think it's just going to withdraw maybe.
what if you're not taking prescriptions right now? And I had this discussion with a doctor who was going on Medicare.
Trying to do the math and see.
So I'll just pay the penalty later. The issue is, even if you're 1 year, 2 years, or whatever late, the penalty might be rather small. So even though currently, it's 12% of $32.74 or whatever, but eventually that annual premium, that annual national average is going to keep going up. So it's going to be an ever increasing penalty.
So it's not worth it. You know what? Either get a plan that has a drug prescription drug coverage included in it, or just get a plan that's relatively cheap. So if you do want to go with a standalone supplement plan, and then again, a drug plan, maybe get one that's $10, $14 a month that you know that you'll just not have to worry about it, and just peace of mind in the long run.
And one more piece from our lovely government. Just like with Part B, if your income is high, they're going to add extra premium. Or with the Part D, they're going to do the same thing. So if you're as a married couple making over $174,000 and $218,000, they're going to add $12.20 a month to your
They
cost.
did that to me, and I'm not in that category.
So
And
then
try to get through to Social Security. Oh my God.
I think I could probably help you with that, but well, again, yeah. So they're going to whack you if your
So
income.
Yes. What?
Go ahead.
Yeah, so whether it's Part B or Part D, if your income as a single is above 88,000 or as a married couple above 176, you're going to have an extra "we love you" tax, so to speak.
But there are things you can do, to lower it down. So yes, we will be around after, and we'll give it, if any of it does have questions or would like to know how to do it.
Just to try to keep things moving here. So here's we mentioned earlier about the donut hole. The technical term for this is called the coverage gap. This was supposed to go away this year. The government says one thing and does another. That's not a shock. What it is once you add in whatever premium you're spending for a drug plan, if you have a premium plan, whatever you're spending for your co-pays, and whatever the insurance company is paying for that drug, once it hits $4,130, you fall into this coverage gap. which until you hit $6,550 of total coverage expense, they're going to be spending 25% of the cost of that drug, whether it's a name brand drug or a generic atorvastatin or what have you. Once you hit 6550, you're going to hit what's called catastrophic coverage, and your copays are going to drop dramatically. So the big thing is, for some people, they're only taking a couple drugs here or there. It's a moot point. But unfortunately, some people, they're taking a lot of drugs, or at least a lot of expensive drugs. If you're hitting the donut hole early in the year, chances are you're going to hit that catastrophic coverage at some point. So you kind of want to ride it out. But if you're hitting the donut hole later in the year, then you really want to start looking at where you're getting your prescriptions. You know, maybe go online to goodrx.com and see who offers your drugs the cheapest. Or maybe look out at some of the mail order facilities, like in Canada, mail order, canadianpharmacy.com, canadiandrug.com. There's many. For some drugs, they give you a great deal. And for others, it may not be much. But again, you want to be your own little advocate, because
some of these drugs are going through the roof of what they are charging and the cost. And we're talking some drugs that everyone almost is on. So
asthma drugs, heart drugs, diabetic, you've all heard the stuff with. So you really, want to make sure you're doing your homework or have somebody assist you. We're going to try to keep moving here.
Oh,
Well, and again, we'll stay around.
it's fine. If anything does come across, you have a question, please do ask.
All right. So big pros and cons of supplement plans. The biggest pro is freedom. Yeah, you're going to pay for it. In our example, $170 a month to $270 a month, but you're going to have predictable healthcare costs. If you had the F, your only healthcare costs besides drugs is going to be your premium. But, and here's the big one, dental, vision, hearing are not included in Medicare supplement plans. There are companies that will let you add them on. They call them extras or whatever the term is.
For an additional fee.
For an additional fee. So something to keep in mind, depending how important those features are. Again, all the plans are regulated, they're standardized, so it's all about getting the cheapest one. Do not spend more per month for a plan. You're not getting any extra benefit from it. Again, you do have to get a standalone drug plan. Here's a big one, guaranteed renewable. State of Connecticut is one of the few states that no matter how healthy you are or not, healthy as a horse,
Sick as a dog. Mm-hmm.
We love our animals, especially in our house. You are accepted. They do not look at your medical history. However, there are states, and many of them, where they will look at your age, smoking, on and on and on. So if you do plan to leave the lovely state of Connecticut or New York, which are guaranteed renew states, beware, because you may be in for a little rude awakening. And last but not least, premiums can and do go up every year. So just because you have company A this year doesn't mean they're going to be the most competitive next year. Any questions on supplement plans?
And again, we will be around after the class. So hold on, we have one question in the chat box.
Collecting Social Security, received Medicare card in the mail.
That's not full. There you go.
Excuse
a long text
ones.
box.
My husband is retired and collecting Social Security. He received his Medicare card in the mail. I am working and he's covered by my good medical plan. Are we all set? We do not need to do anything. Is Part B required and needed? As I understand it, costs will be deducted from Social Security. Yes. So as long as your company has at least 20 or more employees, then he's good to go.
But one thing I will recommend for those of you, even though yes, he could stay on your group insurance, but sometimes it's actually cheaper to go on Medicare and go this path instead. And it's definitely good to review.
It used to be was a no-brainer, stay in the company plan, but more and more, we're seeing it with unions, we're seeing it across the board where staying on that company or union plan, you might be better, just basically better off going on Medicare.
And you can also get sometimes more bells and whistles going on Medicare than you would stay on your group plan.
All right, here we go. Time to forget all this. Oh, go ahead.
Yes, go. Sorry.
Okay, go ahead. I thought you were finished with the whole presentation. I wanted.
No, we have another quite a bit more to go. We cover.
Oh, all right. So I just My question was, what is the big difference between the supplement plan and the Advantage plan?
Good question, because guess what?
Time to forget the supplement stuff and let's get into the world of Medicare.
I promise we cover everything we know about Medicare.
So,
Okay. Advantage is the next discussion. Okay,
Yeah.
got it.
yeah, somebody asked if you have some of the prescription discount card websites say if you have a Medicare card, you are not eligible. Correct. It still doesn't mean you can't shop around.
And be your own advocate, because there are ways you can get the drug cheaper, and so.
So here's the thing. Advantage plans is the other alternative besides supplement plans, otherwise called Part C as in Charlie. They've been around since 1997. And the reason they came into being is just like now, Medicare was in trouble. And one of the reasons it was in trouble was many people that worked for, whatever company, Pratt Whitney, IBM, whoever, they had their group health plan. They went to the doctor, did their physicals. Then they went on Medicare, and Medicare didn't cover those wellness visits. So a number of people, unfortunately, stopped going to the doctor and didn't, maybe they had cholesterol, blood pressure, whatever issues. And the next thing you know, they're having a heart attack or a stroke, a major burden on the government. So the government went to all the major health insurers and said, look, you play ball with us. You take over the role of Medicare. People are still going to pay their Part B premium, whatever that might be. But the Part A, we're going to reimburse you. So the average Medicare Advantage plan, that company is getting for each person who signs up about $11,000 a year. What they do with that $11,000 plus or minus changes, based on each company and their claims and exposures and what they think are important and not important. And by the way, that reimbursement, it could be higher or lower depending on what's called the star rating. So the highest star rating a company can get is 5 stars, whether it's a drug plan, Advantage plan. If they have the 5 stars, they're going to get the highest reimbursement. If it's 4.5 stars or 4 or 3.5, the reimbursement is less. That's why they're all trying to push to make their ratings go higher. And what's one way they're doing it? For all the females in our little audience today, ever go to your OBGYN and starting to notice they're asking you a lot of kind of nosy questions about things that have really nothing to do with OBGYN?
Like, do you feel safe at home? Some very personal questions that, like, why are they even asking? It's, and especially usually it's right on the tablet. They say, or nowadays they'll send you a thing ahead of time to answer at home. But
they're doing it because they want to supply it to the insurance company to get them the ratings and give that doctor better reimbursement, and it just kind of streams down. So anyway, just something to keep in mind. But ultimately, the whole idea of Medicare Advantage plans was twofold. One was to create one-stop shopping. Because on the other side of the fence, you have your Medicare card you have to show, your supplement card, and your drug card. Here, with whatever company you're with, it's going to cover your hospital, your doctor, your prescription drugs. And depending on the company, it's going to give you dental, vision, hearing, and some other things.
And plus all the extra bells and whistles you don't have on the other path.
So number one is one-stop shopping. Number two, this is the side of the fence that's all about preventive care.
Catching it early.
So on this side of the fence, you go to your doctor, your primary care doctor for a physical.
Guess what?
What's your cost for that physical?
0.
You go for the flu shot, pneumonia shot, soon to be COVID shot, whatever, copay, 0. They want to catch it in advance. Bone density exams, all kinds of things.
Mammograms, catching it early.
Colonoscopies, which used to be, we're on the hook for 20% of that. They want to catch it early. So this is the side, it's all about preventive care, one-stop shopping. So how do you buy an Advantage plan, and what are your choices out there? So number one, most companies offer anywhere from 4 choices to 12 or 14 choices. The 2 basic models, though, are the 0 premium plan and a premium plan. So what's the difference? Well, why can one company be 0, one can be premium? Because ultimately, when we look at premium plans and 0 premium plans, are they worried about you going to the doctor 2 times a year or 22 times a year? Probably not so much. They're more concerned about you going to the hospital. So the zero premium plan might say, you go to, Norwalk Hospital, you go to Stanford Hospital, Yale, wherever, your first 4 days, you might hit you with a $450 a day copay for the first 4 days.
That you are inpatient at a
Inpatient
hospital.
at a hospital. If you're still there after 4 days, okay, we're going to waive it. The premium plan, instead of $450 a day for the first 4 days, maybe it's $400 or even maybe $350. So that's difference number one. Difference number two is what's the maximum out of pocket you could spend if you have a Medicare Advantage plan. And up to last year, that number was $6,700.
But they did increase it a
They
little
finally
bit.
increased it this year to $7,100, which not every company did. So if you have a zero premium plan, the most you could spend a year for medical expenses, not prescription drugs, is either $6,700 or $71,000. If you have the premium plan, which, by the way, that premium could be anywhere from $40 a month to $120 a month.
Or more, depending on the company.
Your max amount of pocket might be a couple thousand less. So,
But you're paying that monthly premium, so
here's another pop quiz. Do you think it's easy to hit the $6,700 or the $7,100 for that matter?
from what we just told you, what does everyone think? Yes, no, maybe? What is? No, what do?
I see some shaking
No.
head. Oh, I see
No.
some.
I think if you're basically a healthy person and you're not going to hit 6,700 unless you have an accident and have to go in the hospital.
We have no
So here we go. So let's do this.
Okay.
Let's say you spend 10 days as a patient, under, what do you call it? You're admitted to the hospital at Yale for 10 days. Hospital. You've got a heart condition. You've got something.
You got to be in there quite a while.
What's the most you're going to spend for that 10-day visit?
From what we just said.
On the Advantage plan, zero.
You'll actually
On the
spend,
Advantage,
you'd spend 4 days of $450 a day. So you'd spend $1,800. You'd still be on the hook for something, and if you went back for another 10-day visit, again, the most you'd spend is 4 days times 450, $1,800. So even 2 10-day visits, you're roughly at $3,600. So the reason why people hit the maximum, which doesn't happen much, is either they have very, very expensive same-day surgery, but even that, most companies now, instead of charging you 20% of the outpatient procedure, they do a flat fee, but some still do the 20%. But remember, if it's $100,000 surgery, Medicare says it's not worth 100, it's worth 40,000. And the most you'd be on the hook for is 20% of the 40,000, that's 8,000. But how often does that happen? Rarely. The number one reason why people may hit the maximum out of pocket is something called the skilled nursing facility. You've got that left hip replaced, the open heart surgery, and after the hospital, they want you to go to the skilled nursing to recover. All these plans work the same for the first 20 days. Your cost for the first 20 days in a skilled nursing facility is zero. But from day 21 to day 100, because after day 100, what happens? Medicare goes away. You might have a daily copay of $172 a day.
Which is then where you can start adding up. So,
If you're there beyond 20 days. So
and if you go past and go up to 100 days, after that, you're on your own 100%.
that gets into the world of long-term care. So that's the way you buy a plan. What types of plans are there? 3 basic models. The original model was an HMO, health maintenance organization, which meant you can only go to a doctor, you can only go to a hospital that was within a network. Then they started adding in these PPO and POS, preferred provider organization, or POS, point of service, which say, you know what, if you want to go to a network, no problem, but you're going to spend a little bit more for that visit. But here's the thing. You think there might be a reason why a doctor or a hospital, for that sake, doesn't want to participate with a certain insurance company? Maybe they don't like them. They don't like the way they're reimbursed.
There's always a reason why they don't.
So you might want to go see your nice specialist, Dr. Vinny Boomba there, and he says, you know what, I'll treat you but I'm not going to accept assignment from your insurance company. So if you see me, you got to pay the whole freight.
Mhm.
So the rule of thumb is HMO, PPO, POS, whatever. Any doctor that you see at least once a year, make sure they're in your network. And if they're not in your network, either change doctors or change insurance companies. Don't get caught in that, because I've seen more people over the years that thought they had this wonderful coverage, then they went to the doctor and boom, they got covered. So anyways, quick little pros and cons of Medicare Advantage plans. On this side, the biggest pro is if you're relatively healthy, you may have little or no cost on top of whatever your Part B premium is. You do have to make sure the doctors and things are in the network. It is one-stop shopping. One plan does it all, but you are going to have copays, just like if you go to the doctor, if it's a primary and it's not a physical, it might be a $10 or $20 copay. If you're going to the specialist, it might be a $40 or $50 copay. Depending on the company, though, you're going to have dental, vision, prescription drugs, hearing, some of the extra bells and whistles. They're all state-specific plans. So here's one that gets asked a lot. So what if you're traveling and you go to Florida for a few months, you're a snowbird. If you have an emergency, not only are you covered everywhere in this country, you're covered anywhere in the world with a Medicare Advantage plan. There could be a cap of 70, 75,000, but you're covered. However, let's say you want to live in Florida or whatever state, North Carolina, for a few months, and you want to see a doctor when it's not an emergency in that state. There are some companies that will even let you do that. So when you're doing your little deep dive to see, do I want a supplement plan? Do I want an advantage plan? Those are all the things that you have to do your homework on, or as I said, have somebody help you do the homework.
Because within this path, there are companies, like you said, that do allow you to have more freedom and flexibility, not just stay in the state of Connecticut, which you think sometimes for a Medicare Advantage is. So.
Then you have all the freebies, the physicals, flu shots, pneumonia shots. If gyms ever open up again, there's something called Silver Sneakers, which lets you belong to a gym at no cost. You just go to silversneakers.com, enter in your zip code, and they'll tell you all the gyms in your area that participate.
And sometimes, depending on the gym, there could be sometimes, which is happening lately. So with some of these more expensive gyms, there could be a small monthly fee.
All right, we have a quick question in our chat box. With my retiree medical insurance Advantage plan, if I switch out, I can never go back to the retiree medical plan. It's true for some situations. It's pretty good, but there's a cost, whereas some Advantage plans on the market are free. In general, do you find that retiree medical plans are better than the market offerings considering the entire plan feature? I hate to do it, but it depends. Like I said, I've seen every union plan pretty much it used to be the way to go. Now it's not. The cost they're spending.
They're going through the roof, the cost. That's why we love to break it down and compare, because yes, you don't want to leave and then if you can't go back, but if you're spending so much more than you should and you can get better insurance, better coverage, then why would you stay? Also,
some companies require their active employees to still sign up for Medicare. So you kind of unfortunately have to go through that exercise to see which is the best deal. Mm-hmm. Yeah, and many companies, once you opt out of it, you can't go back. So
make the right decision.
Make the right decision. All right, we're going to try to go through a little lightning round of laws and programs, and then again, we'll be around. I just want to make sure we cover all the topics. Trying to be a little time sensitive here. The government laws and programs. We're just going to hit on three. Understand that supplement plans are subject to underwriting after 6 months in Medicare. So if you get sick, you can never be accepted for, again, there's national laws and there's state laws. Because we're in a
guaranteed issue state,
it's a moot point here.
But
so here's a couple of things. When people say, Lou, should I do a supplement plan or advantage plan? Really depends on your situation. But I'll give you the ultimate example. Years ago, I had a mechanical engineer, MBA, very bright guy, unfortunately got a brain tumor. The only place that was even willing to operate on him was at Mass General in Boston. Unfortunately, knock on wood, they got the whole tumor. But every few years, he has to go back to Boston for a return visit to see if the tumor is making a return visit. So the year he goes to Boston, he goes on a Medicare supplement plan, so he's got everything covered. The other 2 years, he sees his doctors on a quarterly basis. He goes on a Medicare Advantage plan. He's switching back
The
and
state
forth.
of Connecticut, you can switch back and forth, but going back to that question, the only time they can do medical underwriting, please do not miss your Part B premium. If you miss it more than twice, you'll be kicked out and have to go through this whole process, and medical underwriting is involved.
And another quick one. We've had a number of companies that when people retire, they offer them extended health coverage. So the
This is
employer,
coming up a lot lately.
and it's become a killer. So especially for people that are at, or 65 or older. So what happens, you then fall into the special election. So even though you think you've got a year's worth of coverage, you actually only have 8 months of coverage. And so people then, they go to apply for Medicare Part B, and the government says you haven't had viable coverage. You weren't an active employee. So shame on you. Just like you've heard of COBRA coverage for people that get let go, they can keep coverage for the employer. Medicare does not consider COBRA viable either. So again,
You're at that 65 age, you can't go on COBRA, you have to go on Medicare.
so
Let's keep going, so and we'll can always go back.
So the first of the government programs and laws is something called the Medicare Savings Plan or Medicare Savings Program. It's a nationwide program that each state administers through the Department of Social Services. In a nutshell, and each state has different little guidelines, but if you qualify at any level, that Medicare Part B premium goes away. At any level, your prescription drug cost will be reduced to nothing. And if you qualify at the top tier, or what they call it, all your A and B deductibles and copays go away. Now, most states look at both your assets and your income. The state of Connecticut is one of the few that only looks at your income. And those numbers are there on the left. If you're single, and these are up-to-date numbers. The thing is, they don't look at all of your income. They look at a lot of it, but not all of it. So if you're collecting Social Security, it counts. If you're on a fixed pension from XYZ company, they'll count that. If you've got dividend and interest income coming in from your investments, they're going to count that. But what if you're a vet, and you've got $2,000 a month covering your Agent Orange? They won't include that. But here's the big one. Anybody here have an IRA or 401k? Hopefully a few. And you've hit that ripe age of where you have to take your what's called required minimum distribution, that which used to be at age 70.5, now they just bumped it to age 72. So let's say you have $500,000. And by the way, the minimum distribution is a percentage of your total of the previous year that goes up every year. So roughly for a 72-year-old, they want you to take out about 4% of that IRA 401k. So if it's $500,000, 4% of that is about $20,000. If you take that $20,000 and you divide it up equally over the year, take it out each month, they will count it when it comes to this program. But instead of taking $20,000, you take out $25,000 and you take it out once in the year, it's considered an asset and doesn't count towards the qualifications of this program.
Oh my goodness.
Here's the thing. The state of Connecticut knows everybody's income because you all file tax returns. And if your income is too low, they know you're automatically eligible. Roughly 50% of the people eligible for this program are not on it. And why aren't they on it? Either they don't know about it, or maybe they've heard about it, but they don't think they qualify.
Oh.
So what I tell everybody, it's a program. It's one of the few states that only looks at income. If you do qualify at the top level, it's going to pay all your Medicare expenses. At any level, it'll pay both your Part B premium and your prescription drug cost. It is something, once you're on it, you have to renew every year. So it's not forever, but most people that once they're on it, they tend to stay on it. And here's a big one. If you do qualify, you're in what's called the special election period that's permanent, because there are Medicare Advantage plans that work hand in hand with the Medicare Savings Plan. They give you extra bells and whistles, They'll cover transportation to the doctor, extra money for over-the-counter items, just, kind of things of that nature. So I'm sure there's people in our audience that maybe themselves, but maybe other people they know, an elder parent, friend, who knows, that might be eligible. So Medicare Savings. Lightning round continues. Social Security. Whether you've made your Social Security selection or not, we're going to go through the Reader's Digest version just to give you a little bit better handling of what's really going on with Social Security. So number one, when can you take it? Unless you've been disabled and you went on it at a younger age. For everybody else, there's an 8-year window. Earliest age is 62. The latest you can defer is 70. And then somewhere in the middle is this thing called full retirement age, FRA. Quick pop quiz. Does anybody really know the definition of full retirement age when it comes to Social Security?
What it actually means, stands for. Any guesses out there? Because there is a reason, so.
Because a lot of people get confused with it. Well, that's when I'm fully retired. Well, yeah, that could be. But here's what it is. From age 62 until your full retirement age, we're going to show you the chart in a second. If you are still working and making over $18,000 a year, for every $2 you make above that, $1 of your Social Security benefit goes away. So let's say you're making $38,000 a year. You're $20,000 above that. So half of that, $10,000, would then get reduced or deducted from your Social Security. So if you were collecting $20,000 a year from Social Security, next thing you know, it's at $10,000 a year. Once you hit your full retirement age, you're going to be making $1 million a year, your benefit won't be reduced. So when people start deciding, do I take it early, do I take it late? Part of it is obviously, do you need the money? If you have no choice, you have no choice. But just be aware that you can be penalized if you're making too much during the early to full retirement window. And yes, we are seeing more and more people take it early, unfortunately, because when are you going to be as healthy as you ever going to be? Typically where you are today, not a year from now or 5 years from now. Also, are you single or married? 4 or 5 years ago, there was something called Social Security double dipping, where for a married couple where both spouses worked, the spouse that made more would collect their benefit, and the spouse that didn't make as much, instead of taking their benefit, it would do something called file and suspend. And then instead of taking their own benefit, would take half of their spouse's, and their own benefit would grow in a year. So for some people, this could give them a $5,000 to $10,000 a year raise. Now they've aged it out. So for some people, it's not even an option anymore. They've changed it to what's called a restricted benefit. Again, for married couples, if you're both married, still alive, the second spouse can never make less than 50% of the higher earning spouse. So if you worked and spouse A had $2,000 a month, but spouse B was at $800, they would bump them up to $1,000. So you made whole that way. Everything else, you need to contact Social Security if you think this double dipping or file and suspend might still be available to you. They're the keepers of the bucket. Next thing, I'm not making as much money as I used to because of COVID. Is that going to reduce my benefit? The answer is no. Social Security looks at your highest 35 years of one, and they just average it out. Whether it's your first 35, last 35. The thing they look at, though, is when you get that statement in the mail about your Social Security, you're given 3 numbers: your age 62 number, your full retirement age number, and your age 70 number. But what if you want to retire at age 63 or 69 or whatever? This calculator there at the bottom, you can then go in and calculate and look at to see what your benefit would be at a different year. Obviously, you can contact yours truly, and we can assist you with that. Full retirement age, this is the chart. So based on your year of birth, if you were born from 1943 to 1954, full retirement age is 66. You turn 65 this year, born in 56, it's 66 in 4 months. If you're born in 1960 or later, full retirement age is 67. Anybody see a pattern here?
What exactly is happening?
By law, the full retirement age is supposed to go from 65 to 68 over a 36-year period.
So there's going to be a whole nother.
But ultimately, in our lifetime, early retirement, instead of 62, will be 65, and full retirement will be age 70. Now, if somebody's collecting Social Security, they're our age, they're not going to have their benefit reduced. But these young whippersnappers, they're the ones that they're going to have to work a little harder, a little
And we're going to have
longer.
to start saving earlier than ever, because bottom line, you'll be grandfathered. They're not going to cut your benefit. But for our benefits, who knows what's going to happen in 20, 30 years if we'll be able to have it. So save up early and often is what I'll do.
Any questions on Social Security? I'm just trying to go through these before we let you know. And I'll be around afterwards to answer any old questions. This last topic, it's about a 3-hour topic. No, just kidding.
It actually could be,
It could be.
with all the stuff we cover with it.
And that's ultimately when working with seniors, the biggest issue I deal with and hear about is the fear of running out of money. And the two biggest reasons why people run out of money in retirement is either A, they've got too much of their assets exposed to the stock market, or that they, or if they're married, their spouse needs some kind of nursing home care.
Yep.
A or B can be devastating, or some combination. So quickly, the stock market, as wonderful as it is as a place to grow money, we know typically every 3 to 7 years, the market drops 20% or more, does a correction. 1994, 99, 2001, 2008. Then we went through a 12-year period to 2020. And then guess what? Dropped, and it kind of came right back up in a V. But who knows when the next time that's going to happen? The problem is, if you're at or near retirement, can you really risk or have the time to recover? Because sometimes the market returns fast. But let's take two quick examples. 1973 to 1982. The Dow Jones in 1973, I normally would do a pop quiz, but for the sake of time, was at 1,002. 1982, 10 years later, it was at 1,003. In 10 years, it went up 1 point, mostly because of 1973 and 1979, the two big oil years, which caused a lot of harm. So it was a flat 10-year period. More recently, 2000 to 2010, no matter where you had money invested during that 10 years, chances are you made little or lost money. But again, only 2 bad years, 2001, 2008. So unfortunately, when you go from trying to build up your nest egg in what we call wealth accumulation phase, to where you're kind of transitioning into either wealth preservation phase or wealth preservation and income phase, the way you hold your assets has to change. And it's one of the biggest sins that's happening in the financial industry, because unfortunately, most people in the financial industry don't care if you're 65, 75, or 45. If you've got money, they'll gladly invest it. But it's totally different when you come on our age. Now, again, part of it is based on somebody has 100,000 to their name or 2 million. Person with 2 million's got a little bit more leeway, or they can take maybe a little bit more risk. But either way, you want to be smart about it, because if the markets don't recover, your income, and if the timing of when you start taking, imagine that you're starting to take your withdrawals and the market drops 30%. You have $1 million, next you know it's 700,000. That's a game changer. Or obviously if you have 500,000, it's now 300,000 or 200. So again, making sure assets are positioned. Secondly, most people's portfolios, when I look at them, people have no idea how they're going to generate income from them. You might have a portfolio that's at a 6, 7, 10% rate of return, but then I'll look at the thing called yield. It might be 1.12% or whatever. So again, you can get better than that at a bank. So anyways, positioning assets, one rule of thumb is take 100, subtract your age. A 65-year-old theoretically might want to have about 35% in the market, for some a little bit more, some a little bit less. But again, you've got to take care of yourself, because that money you're going to need in retirement. Retirement's not a 10 or 15-year thing anymore. It's a 30 or 40-year retirement. That money has to be there forever. So anyways, risk number one is making sure you position those assets properly in retirement. Secondly, though, is the likelihood that you, or if you're married, your spouse is going to need long-term care. And right now, for a 65-year-old couple, odds are almost 90% that one or the other is going to need care. The old saying goes, the government will always take care of whoever needs care. They just don't care about the survivor. Right now in 2021, if you're married, you're allowed to keep one home, one car, and up to about $130,000 and change. If you're single, no home, no car, $1,600.
And $60 a monthly income. And by the way, the numbers for a single person haven't changed in years. The married couple are going up steadily a little bit every year.
The problem is, what if you do have assets above and beyond that? They're going to burn through them like no tomorrow. So what are your options? How do you protect those hard-earned assets? It used to be you can try to go out and get long-term care insurance, but as the old saying goes, it ain't what it used to be. It's been around for over 30 years. The products used to be competitive. Unfortunately, all the baby boomers started having claims, and next thing you know, companies, the Metropolitans, Prudentials, and Travelers all get out of the business. And then the companies left, they get the ability to raise your premium even after you've taken it out. So it's just putting, unfortunately, people, in harm's way. Some companies are trying to get creative with some variations, combining life insurance with long-term care, but it's not for everybody. So what are your other options? We always hear about, well, I'll just give it away.
I've heard that so many times over the years, and more than you can say. It's a lot.
So you can either give it to an individual or give it to a trust. Quick law classes. So you give it to an individual, you give it to your child, your neighbor, your brother, whoever, but you kind of need some of that money. So you do a little handshake, wink, wink deal and say, look, I need a couple thousand a month to live. The problem is it's not your money. It's the money of whoever you gave it to. And what happens if they get divorced, get sued, get in a car accident?
It's not yours.
It's gone. Good measure. It's not totally free and clear until after 5 years have passed. So gifting to an individual, not so good. So you can gift it to a trust. Well, trusts come in two flavors: revocable trusts and irrevocable trusts. Gift to a revocable trust, well, guess what? It's revocable. You can change your mind. You probably have heard these commercials or the one-page ads in the paper, come to my class on living trust. They're designed for assets to bypass probate, which is another whole topic, but they do nothing to help assets bypass nursing home exposure, because you've never started the clock on the look back period, which leaves irrevocable trusts. Problem with irrevocable is that they're irrevocable. Once you put money in there, you can't change your mind. You can't change the asset. And for good measure, you got to wait 5 years until the money's free and clear. Now, up to over 10 years ago, used to be a loophole that I used to call Lou's loophole, since I probably took more advantage of it than anybody. And that was, if you were in the nursing home, you were the spouse, and let's say you had $500,000, I could still protect half of those assets. I would have you keep $250 and give away the other $250. Let's say, to keep the math simple, the cost of the nursing home back then was $10,000 a month. So every month you're writing out a check for $10,000. Well, after 25 months, you're out of money. So the nursing home says, all right, we need the next check for $10,000. You go, oh, sorry, I'm out of money. All right, no problem. We'll begin the Title 19 process. And one of the first questions they're going to ask you is, in the last 5 years, have you made any gifts? Oh yeah, a couple years ago, I gave away $250,000. But every month that passed, you protected that number of months worth of nursing home costs. After 1 month, you protected $10,000. After 10 months, $100,000. After 25 months, you protected $250,000, even though that was well within the 5-year look back period. Unfortunately, they figured out Lou's loophole.
They got rid of it.
They got rid of it. But a year later, they passed a law of a case through our office that allowed people to protect certain IRA assets from the nursing home. They even then passed a law allowing certain non-IRA assets to be protected. Now, unfortunately, laws can change, tweak, and so forth. There's things out there that people aren't aware of. For example, I mentioned the whole asset rule, but do you know that the spouse that's not in the nursing home is called the non-institutionalized spouse, is allowed unlimited income. So there's certain things that people can do to protect or at least position those assets. So God forbid something happens, there are options. There are things that people can do. And the problem is, even lawyer, we have attorneys calling our office all the time. What do we do? You know, there's a nationwide company that helps people get on Title 19. And when those people are over asset, they send them to us. You know, we're the gurus when it comes to doing this. So the point is, it's just like it's a lost art out there. People that say they're doing retirement planning, they're really not. And for those of you that are worried about yourself or a parent or a relative or whatever, you know, there are options. Now, there's more options if you're married than if you're single, but there's still things that people can do. Now, I know we've hit the bewitching hour, so I'm going to stay around. That way, if people want to go watch I don't know what's on television on a Wednesday night, Red Sox, Yankees, or whatever.
Whatever your show of choice is. So,
All right, quick little recap of who we are, what we do.
and what we call ourselves is Comprehensive Retirement Planning Specialist. We deal with Medicare planning, all the companies out there.
So we're well known for that. We're the largest in the state of Connecticut. But above and beyond that, we do help people protect those assets from the nursing home. And so forth. How about making sure you have enough income to live the rest of your life? What if you have both IRA pre-tax money and post-tax money? Which strategies should you be using for positioning those assets, and which ones do you take first? Does somebody over age 55 or 60 still need life insurance? You'd be surprised.
Maybe
What
they
if you
do.
still have debt, or somebody still working, and if they were gone, their income or their might be missed? And finally, all the different laws and programs for people over age 60 that most people don't know about or in depth or about what to do. What we offer for all the folks who attended our classes, no cost, no obligation, is the chance to review any of your current situations, questions on any of the topics or any combination. The way we earn our keep is if we help somebody on the Medicare side, you don't pay us, we get paid by whoever the insurance company is. If we help somebody in the financial side, again, you don't pay us, we get paid by whoever the financial institution is. But sometimes the best advice we can give somebody is update your will, get that medical power of attorney, apply for that Medicare Savings Plan. Don't know. Again, you know, even though we can act like attorneys on television, we're not attorneys in real life. At the end of the day, if we can help you directly or indirectly, and you felt we've been helpful to you, educated you, made you aware of things that other people weren't making you aware of, then hopefully you'll pass our name on to other folks that can benefit, whether just attending a future class that we have or
At the Fairfield Library. And thank you, by the way, Claudia, for having us this Wednesday afternoon.
so on that. Here's all our contact information, because we don't know who you are.
Nope.
Only way we can speak to you is if you call or reach out to us. So on that note, I know we're going to stay around to answer any questions. Again, Claudia, thank you so much.
Yes, thank
Thank
you.
you, Jessica. This was, I think it brought up a lot of questions for a lot of people. It was very comprehensive. Well done. Thank you.
We try to
Thank you. Excellent.
fill your brains with
You did that.
Bottom line, we don't know what your knowledge is from the next person on the screen. So we try to cover as much as possible. So you learn at least a few things that you didn't know before.
and we do this
you.
in
You're
depth
welcome.
when
Thank you for
when
coming.
we do our little retirement class, same concept. We kind of do a deep dive on all the pieces and things that we think people should be discussing as we talk about. So if anybody has any questions, chat box, fire away. Give it a 30
Or
seconds.
unmute yourself and just ask the question.
Yeah.
I have a question. You said that at one point you said that if people take out from their 401k once a year instead of monthly, it's not as taxable.
That's for the Medicare Savings Plan when they then do the income calculation for that.
Medicare Savings Plan. Okay. Now,
Which, by the way,
is that only if you're over 72, or can you start? I'm withdrawing from my 401k now because I need that as a source of income.
they're gonna count that.
Oh,
That brings up a good point. We see a lot of times people have maybe 2 or 3 IRAs and maybe they still have their 401k. When it comes to those minimum distributions, let's say you had $500,000 in 3 IRAs and another couple $100,000 in a 401k. if you had to take out 4% of the 500 was of the IRAs, they don't care where that 20,000 came from. But your 401k, you couldn't mingle in as far as doing the calculation. So that calculation has to be done separately. So you have to take out a separate 4% of that 401k. Well, if it's in an IRA, you can pick and choose which ones you want to take it from to satisfy that minimum. But any 401k or 403b, you've got to take that distribution directly from there. It messes up a lot of people because they tend not to do the minimum correctly.
Okay, well, but that's if you're over a certain age, then you're required to do the minimum.
Correct. The age
Younger than that.
it got bumped from 70 and a half to age 72 is now the new required minimum age, early age.
Any other questions, and this is our contact information. You can please, if you have anything that comes up or would like to answer us, please feel free to reach out. We aren't shy and we are very, so, and again, I hope everyone enjoyed this class tonight and thank you for coming.
Thank you. Thank you very much.
Thank you very much. This was a lot of information, but it was good.
Hopefully it helped everybody. Again, if we can be of help, please let us know. Please let Claudia know if you enjoyed the class, and we'll hopefully.
I'll be sending out a survey tomorrow morning.
Well, thank you. Let us know how it is.
I will.
All right, everybody. Thank you so much.
Thank you. Good night, everybody. Thanks, Lou and Jessica.
Be safe.
Bye.
Good night.
I'll be in person.